Hi, Dr. Scott Jensen here. I want to talk today about hospice. So let's start out with saying this. Happy birthday, former President Jimmy Carter. You turned 99. But I think amidst a life of so many accomplishments, you're doing one more, whether you fully realize it or not. You're touching people all over the country, all over the world, with the way you're saying goodbye to earthly life and hello to what lies on the other side of that threshold of death, that space of eternity. I think it's important to realize that when Jimmy Carter enrolled in hospice care 7 months ago, this wasn't a death sentence. But I think sometimes we feel like that. I was involved with originating a hospice program 30 plus years ago. Medicare's gotten involved in the act as well, and some of the things that Medicare have been good, and some have been challenging. Medicare provides financial support for hospice care, and that's important. But along the way, sometimes people have gotten the wrong impression. Wrong impressions might center on, well, I've got to be dead in 6 months, or I get kicked off the program, or I have to do this or that. There's basically 3 criteria that I usually talk to my patients about if we're looking at going with hospice care. One of them is you need to have a diagnosis that in some way or another would be considered terminal. Number 2 is that your life expectancy is reasonably figured to be less than 6 months. And 3 is that you're going to take a pass on potentially aggressive curative therapies. In other words, you're recognizing that this is not a time for medical technology to come to the fore, but this is a time where nature's going to take its course. Death is knocking at the door, and the patient, the loved one, is ready to say, I'm ready. Now, Jimmy Carter exceeded the 6 months. Does that mean he got kicked off the program? No. He'll probably be enrolled for another 6 months. That's what I typically would do with my patients. But the fact that 7 months after he enrolled in hospice, he's with us having peanut butter ice cream and maybe rooting for the Atlanta Braves in postseason baseball isn't really that big a surprise to me. I think there was an interview with Jimmy Carter's grandson, I think his name is Jason Carter, who had said something like, well, we thought that it was going to be, saying goodbye to Grandpa in 5 days or so, and then we thought maybe it was going to be in a week, and then we thought maybe it was going to be, a little longer or something, but now it's been 7 months. And that's exactly right. It's interesting that if you look at the medical research, studies have been done where one arm of a study has patients with a similar diagnosis going into the hospice arm, and another arm of the study with people with similar diagnosis and stage of disease going into a more conventional aggressive management program where we continue to not necessarily accept those realities of hospice care. And if you look at the outcomes, it's astonishing. And yet maybe it's not. So many people who go on hospice outlive those people who continue to experience the full menu of conventional Western medicine. Let me say that real clearly. So going on hospice, patients outlived the cohorts that went into the we're going to continue aggressive therapy program. And the quality of life was immensely better. I don't know if you know anybody, particularly the nursing staff, that works in hospice care, but across the board in my career, and that's now 40 plus years, I think hospice care workers are literally angels on earth. They do such an incredible job. Patients and patients' families tell me so often, these people coming into my home, these people sort of taking charge and helping choreograph the care that I'm going to receive, these people gave me such peace. As a physician, I think one of the most important things I can do for my patients when a patient goes on hospice is that ministry of being present, being available. I frequently do house calls, especially within that first couple of months of hospice care, to make certain that there's a comfort level, to make certain that we've sort of checked the boxes, make certain that we have all the various equipment that might make life a little easier. And let me tell you, there is a huge difference between a home arrangement that has facilitative equipment and one that doesn't. My wife recently had her knee replaced, full knee replacement. I had hand surgery done within the last few days. Our house has bandages and gauze and walkers and canes and ice packs and machines and devices that we normally would never see. And our house is filled with them, virtually every darn room. I can't wait to get back to normal. But hospice is important. And so oftentimes, I think physicians fail to invite a patient or their loved one into that consideration of hospice. So I would encourage you, think about it yourself. I know in a couple of weeks, I'm going to a program, I think at Bethel Lutheran Church in Minneapolis. It's called Living with the End in Mind. And it's going to have Pat Miles and Don Shelby and Kathy Wurzer talking about how do we deal with those end months or end years. I'm going to go and just be a part of the audience because I think this is a hugely important conversation. So it's a beautiful Sunday here in Midwest, and Jimmy Carter had a 99th birthday, and I think he's giving testimony to all of us as to how a life can be lived where the ending is dignified, supportive, and sort of taking a different approach than we often might expect. Hospice care is not a death sentence. Oftentimes, it's an invitation to a better life. It's an invitation to saying no to having every day of the remainder of your life devoted to physicians and hospitals and treatments. It's an invitation to say, you've fought the good fight. You're finishing the race. You're keeping your dignity. It matters. Thank you.